The doctor will see you now. A sick person might wait days, weeks, or months to hear those words. Through a Patient-Centered Outcomes Research Institute contract, researchers at the Indiana University School of Informatics and Computing at IUPUI are undertaking the problem of access to healthcare.
Our particular research project, Enhanced Access, it's all about trying to get patients in a more timely fashion. I can't get over the fact that really one of the things I learned early on, that 33% of the time, patients aren't showing up for their appointments. And that seems like an incredible waste of time.
The team has partnered with 7 community health centers that have over 40 sites across Indiana. These centers care for underserved patients in rural and urban areas where barriers to access are intensified.
This is a multidisciplinary research project involving health services research, industrial engineering or operations research, and informatics. Informatics is at the core of this research project because this is essentially a data-driven project.
Access to care is a complicated problem with many contributing factors. To improve patient care, there's a great need for a modified scheduling system.
The PCORI study has been a 3-year process that looked at the barriers to serving the underserved in Indiana, the capacity for the patient to be able to access quality care on their own schedule.
But a lot of our population, a lot of our demographic struggles with making those kinds of choices. You know, I gotta find a babysitter, I have to find transportation, I have to find somebody to take care of dad because I need to go to the doctor.
The team is redesigning scheduling systems in participating clinics. The scheduling data is linked to dashboards that help the clinics visualize and better manage patient appointments.
So in a traditional scheduling system, you still have some same-day appointments, but those are usually accommodated through double booking or where providers have to work overtime to fit the patients in. And often what happens is patients are frustrated and they may go to urgent care facilities or emergency room to receive the same type of care, but that care is not personalized and is very expensive to the healthcare system.
To put patients first, the team is basing the research on a culture of care.
Well, the research suggested that if we looked at 2 factors, customer focus and a climate of quality, if we could look at those 2 aspects and build those aspects into the clinic, into the clinician's care, into every aspect that the patient has in interfacing with that clinic, that we would better be able then to have a clinic that was creating a culture of care.
Trust, respect, compassion. In sessions like these at an urban clinic, the team works with clinic staff to build a culture of care.
You're gonna have patients show up more if they in fact know their caregivers care about them. Why are you here? How long have you felt this way? Can you afford this medication? Are you able to get to the pharmacy? And in a couple of days, can I call you or can we have someone call you to see if you're improving?
The researchers found that an optimized open access scheduling system allows more patients to get the care they need in a timely fashion.
We found that implementing open access scheduling, where bulk of the appointments are same-day appointments, lead to much lower no-show rates, improvement in provider productivity and other efficiency measures. It also leads to greater satisfaction to the patients and the clinic staff.
I think that's really the focus, is getting more access in a timely fashion for our patients.